You have been feeling a little off for a few days, tired, a little run down. Nothing you would mention at the doctor's office, and yet your dog has been acting strange. Staying closer than usual, pressing their nose to one specific part of your body. Looking at you a little too long. Most owners chalk this up to coincidence. The science says it is not coincidence. Your dog has been picking up something measurable about your health, often before you have noticed it yourself. And it isn't because your dog is psychic or magical or because they are reading some mysterious sixth sense. It is because their nose, with around 300 million scent receptors, is one of the most sensitive chemical analyzers on the planet. Your body, when something shifts inside it, sheds a different chemical signature into the air around you. Doctors call those signatures volatile organic compounds. VOCs for short. A trained or even an untrained dog can pick them up at concentrations of 1 part per trillion, and what the cancer wards, diabetes clinics, epilepsy units, and infectious disease labs have all confirmed in the last 15 years is that dogs are reliably catching changes that human medicine sometimes cannot. Stay for number 6, because that is the one almost nobody talks about. It explains why your own dog at home, untrained, ordinary, pet quality, has an advantage no trained medical dog in any lab in the world will ever have. And it has been quietly working in your favor since the day they came home. 1. The behavior owners notice. First is not random. Most owners only realize, in hindsight, that the dog was telling them something. They remember the weeks of unusual behavior before the diagnosis. The dog who started sitting on the same spot on the chest every evening. The dog who began sniffing a specific mole over and over. The dog who refused to leave the room and would not stop looking at their owner with worried eyes. These reports show up across the medical detection literature with striking consistency. The 2020 PLOS-1 scoping review of seizure alert dogs documented dozens of cases of owners whose untrained pet dog began alerting before the owner had any awareness of an underlying condition. The same pattern appears in cancer case reports, diabetes case reports, and post-COVID research. The dog noticed first, which means the behavior you might be writing off as clinginess or a new quirk, or your dog being weird, deserves a closer look. Repetition is the key signal. A single sniff at one spot means nothing. A specific spot, sniffed daily for 2 weeks, paired with other behavior change, is data your dog is offering you. It is, in clinical terms, an unsolicited screening. Your dog is not behaving randomly. They are reporting. And it usually takes the human a long time to realize the report has been arriving every day. The most striking thing about these reports is how often the dogs zeroed in long before any clinical workup would have caught the underlying issue. The pattern owners describe most often, in retrospect, is the targeted attention to one specific part of the body, a breast, a shoulder, a thigh, an underarm, that the owner had no reason to be paying attention to themselves. 2. They can smell cancer and have been tested in the lab. The first system researchers tested rigorously was cancer. The numbers that came back from the controlled studies are among the most striking in the entire medical detection literature. Trained scent detection dogs have been tested across multiple cancer types: lung, breast, prostate, ovarian, colorectal, melanoma. A study published in 2011 in the Journal of Breath Research found that trained sniffer dogs identified lung cancer patients from breath samples with around 99% sensitivity and specificity. A separate 2021 study on prostate cancer detection through urine involving over 900 samples across cases and controls reported around 99% sensitivity and 98% specificity. Researchers in France, the United States, the United Kingdom, and Italy have replicated similar findings independently. What the dogs are reading, as has now been carefully characterized in journals like Cancer Biomarkers, is the volatile organic compound profile of malignant tissue. Cancers leave specific chemical signatures in breath, urine, and skin. The signatures are extraordinarily faint by human chemical analysis standards. To a dog's nose, they are loud. The threshold of canine olfactory detection is somewhere around 1 part per trillion, the equivalent of detecting a single drop of a substance dissolved In 20 Olympic swimming pools of water, your dog cannot run a biopsy. They cannot tell you what stage. They cannot read a CT scan. But they can detect the chemical fingerprint that a tumor leaves behind in the body around it. And research labs have confirmed that they do so with accuracy that, in some cases, beats current screening technology. The implications for early detection are significant enough that several research hospitals are now actively studying how to integrate canine olfactory screening into routine clinical workflows. 3. They can detect your blood sugar dropping. The second medical system where dogs have been carefully tested is diabetes. Specifically, the prediction of hypoglycemia, the dangerous drop in blood sugar that type 1 diabetes patients can experience without warning. Trained diabetic alert dogs, DADs, have been studied in both lab and home environments. A controlled study published in Diabetes Therapy in 2016 found that trained dogs identified hypoglycemia samples with sensitivities ranging from 50 to 87%, and specificity in the high 80s to high 90s, significantly better than chance. Real-world performance varies, with research published in Veterinary Record showing alert rates that range widely depending on the dog's training history and the relationship with the owner. What the dogs appear to be detecting, again, is a volatile organic compound. Researchers have identified isoprene, a chemical that rises measurably in human breath during hypoglycemic episodes, as one of the key markers. The dog smells the rising isoprene level on the diabetic's breath and gives an alert, often minutes before the owner's symptoms become obvious or before a glucometer would catch the trend. Some pet dogs do this without any training at all. Owners with type 1 diabetes describe pet dogs who, after a few months of cohabitation, spontaneously began pawing, whining, or licking at them during low blood sugar episodes. Nobody taught the dog the alert. The dog noticed the chemical signature on its own and decided that the moment required attention. Your dog can smell a falling blood sugar level. They cannot read the glucometer, but the body chemistry that the glucometer measures is exactly what their nose is built to detect. For some families living with type 1 diabetes, the dog has become an additional layer of overnight safety, quietly checking on the sleeping patient and alerting if the chemistry shifts. 4. They can predict seizures before they happen. The third major detection system, and the strangest one, is the prediction of epileptic seizures. Some dogs, both trained and untrained, alert their owners minutes to nearly an hour before a seizure occurs. Research from Finnegan and colleagues at the University of Lincoln, published in Veterinary Record in 2020, documented owner-reported prodromal changes detected by household dogs before seizure onset. A 2023 systematic review in Epilepsy and Behavior examined the broader literature on dog alerting and responding to epileptic seizures and confirmed that, while individual variability is high, a meaningful subset of dogs reliably alert in advance of seizure events, with advance warning windows ranging from around 10 to 45 minutes. Researchers at Ghent University in Belgium and elsewhere have explored what the dogs are actually detecting. The leading hypothesis is, again, a volatile organic compound, a seizure-specific odor produced in the body during the prodromal phase, before the seizure itself becomes neurologically active. A 2021 lab study using sweat samples found that trained dogs could discriminate pre-seizure sweat from non-seizure sweat well above chance levels. Untrained pet dogs sometimes develop this ability spontaneously, especially in households with epilepsy. The dog watches the patient closely, learns to associate the prodromal chemical shift with the seizure that follows, and starts alerting in advance. The dog has effectively performed its own classifier training, with the patient as the only data point, and only the dog's own observations as the labels. Your dog, in some households, is the most accurate prediction system in the building. The window of warning the dog provides, even 10 or 15 minutes, can be enough for the patient to sit down, move to safety, or take precautionary steps that prevent injury. 5. They can sniff out infections, even the asymptomatic ones. The fourth detection system was caught during the pandemic, and the results came in faster and harder than almost anybody expected. Trained dogs can detect viral infections with accuracy that, in some controlled studies, rivals or exceeds the rapid tests humans rely on. Veterinary researcher Dominique Grandjean and colleagues at the Alfort National Veterinary School in France ran a series of studies during the COVID-19 pandemic using trained Belgian Shepherds, German Shepherds, and Labradors. Their dogs, trained on sweat samples, reliably distinguished COVID-positive samples from COVID-negative. Samples at rates approaching 97% sensitivity. In asymptomatic cases, where rapid antigen tests often missed the infection, the dog's sensitivity approached 100%. A follow-up study published in Frontiers in Medicine in 2022 extended this work to post-COVID syndrome, also called long COVID. The trained dogs were able to identify residual viral chemical signatures in sweat samples from long COVID patients up to 18 months after the original infection. The samples were collected, sealed, and presented to the dogs blinded. The dogs caught a chemical signature that human laboratory analysis is only beginning to characterize, and dogs are not limited to COVID. Other studies have documented dogs trained to detect malaria, urinary tract infections, and Parkinson's disease, all through scent. The principle is the same. Disease changes the body's volatile chemistry. The dog reads the chemistry. Your dog's nose is, in clinical terms, a chemical detection instrument with sensitivity that humans have not yet built a replacement for. Engineers are working on electronic noses that can match canine sensitivity. So far, no machine has come close. And if this is changing how you see your dog right now, go ahead and subscribe. Every video on this channel is built around what the science actually says, not what we assume. 6. The real reason your own dog knows they have been building your baseline here is the one almost nobody talks about. And it is the explanation for why the dog who lives with you, untrained and ordinary, sometimes outperforms the trained detection dogs in a lab. Your dog has something no lab dog will ever have. They have you. A trained medical detection dog is given a sample and asked, in essence, is this person's chemistry consistent with disease X? They make that judgment by comparing the sample to a generic baseline of healthy versus unhealthy samples. They are good at it. They are very good at it, but the comparison is statistical, not personal. Your dog at home is doing something different. They have been sniffing you continuously, every day, for the entire duration of your shared life together. Every morning, every evening. Every time you walk through the door, every time you sit next to them on the sofa. That is, in chemical terms, the longest-running, most carefully calibrated longitudinal scent baseline of you that exists anywhere in the world. When something shifts in your body, a tumor begins to develop, a chronic inflammation flares, a virus takes hold, a hormonal change starts unfolding. Your VOC profile changes. The change does not need to be huge, it just needs to be a change. And your dog, with their personal baseline of you to compare it against, notices in a way no lab dog ever could. This is why so many owners describe the same uncanny experience after a diagnosis. The dog knew first. The dog had been acting strangely for weeks. The dog had been targeting one specific part of the body. The dog had been worried. The science explains it cleanly. The dog was running a longitudinal scent comparison and registering a measurable deviation from the chemical signature they had memorized of you. Read in that light. Your dog is not a pet who happens to live in your house. They are, in a precise clinical sense, the single most personalized health monitoring instrument you own. They are non-invasive. They are continuous. They are always with you. They have a sensor that beats most laboratory equipment. They cost almost nothing to run. They eat kibble. They ask only for presence and patience in return. And in exchange, they offer a layer of medical attention that very few humans in your life will ever match. And the baseline they are comparing your readings against is, and only ever will be, you. Your dog already knows what is wrong with you, in some cases, before you do. Not because they are mystical, because they are honest, and because they have been quietly noticing the slowly shifting chemistry of you that no human in your life has been close enough or patient enough to track. The relationship you have with them is, in clinical terms, the longest unbroken health observation any creature has ever made of you. Most owners never realize their dog has been doing this. The dog never says anything. They just keep watching. The next time your dog starts behaving strangely toward your body, pay attention. The signal you are receiving has been generated by one of the most accurate biological instruments on this planet, calibrated specifically against you over the entire length of your life together. If this changed how you see those small, worried behaviors from your dog, leave a comment telling us what your dog did before you realized something was wrong. What part of you they kept sniffing, how they changed, how early they noticed. We read everyone, and we use them to shape the next videos on this channel. If you want more of the real behavioral science behind the small things your dog has been quietly doing for you for years, subscribe. Every video on this channel begins the same way, with a question most dog owners have never stopped to ask, and then we go looking for the real answer. Not the simplified version, not the comfortable assumption, the actual science, the kind that earns its place across the lab, the clinic, and the living room. Your dog has been watching over you in ways human medicine has only begun to catch up with the next time they press their nose against you a little too insistently and look at you a little too long. Do not brush it off. They might be telling you something important. Across the labs and the case reports, the dogs are right far more often than anybody expected. The least you can do is listen. They will not always be right. They will sometimes worry over nothing, but the pattern of repeated, focused attention to a specific part of your body deserves, at minimum, a phone call to your doctor.